1. Singapore expands acute psychiatry services nationwide, MOH mental health update. 2. Singapore expands acute psychiatric services and launches mental health care guide. 1. Singapore expands acute psychiatry services nationwide, MOH mental health update. Mental health crises don't wait, so why should access to urgent psychiatric care? This is the driving force behind Singapore's bold move to broaden acute psychiatry services across every healthcare cluster nationwide. The announcement, made by Dr. Koh Poh Koon, Senior Minister of State for Health and Manpower, during the Singapore Mental Health Conference at the Singapore Expo on July 16, reveals a strategic shift to make prompt mental health support more widely accessible. But here's where it gets contentious. Can expanding hospital-based acute care really address the complexities of mental health needs on its own? Dr. Koh emphasized that acute hospitals serve as a critical frontline for individuals facing severe mental health episodes or crises requiring expert intervention. While the Institute of Mental Health, IMH, continues to function as the country's national tertiary psychiatric hospital providing comprehensive inpatient and outpatient services, the plan is now to extend acute psychiatric services across all healthcare clusters. This expansion ensures that more people across Singapore can obtain immediate, specialized help when they are in urgent need, a vital step, considering mental health emergencies can happen to anyone at any time. Currently, only 6 out of the 11 public hospitals in Singapore offer inpatient psychiatric care. These hospitals include IMH, Tan Tock Seng Hospital, National University Hospital, Changi General Hospital, Singapore General Hospital, and the newly added Sengkang Hospital. Meanwhile, outpatient specialist mental health services are provided by IMH and every acute hospital, creating a more accessible but uneven landscape of care. In tandem with this service expansion, Dr. Koh unveiled a new practice guide designed for mental health care providers. This guide equips professionals with standardized methods to assess common mental health conditions, beginning with depression and anxiety, and to navigate referrals appropriately to ensure that individuals receive timely and suitable treatment. This approach is embedded within the principles of the tiered care model, which categorizes mental health support into 4 progressively intensive levels. Tier 1 focuses on broad mental health promotion, self-care, and peer support. Tier 4 represents the highest level of care provided at hospitals and specialist clinics. Why is this standardization crucial? Because it helps different service providers across Singapore speak the same language when assessing patients' conditions and determining the level of care required. For example, a distressed person with moderate mental health issues identified by a community outreach team, CREST, Tier 2, can be efficiently referred to a community intervention team, COMMIT, Tier 3, for more comprehensive diagnosis or psychosocial treatment, based on objective assessment tools. The guide, a collaborative creation involving the Ministry of Health, MOH, Ministry of Social and Family Development, Agency for Integrated Care, AIC, and various stakeholders, marks a significant step toward harmonizing mental health care delivery. It initially targets the management of depression, anxiety, and suicidality but leaves the door open to eventually cover other, less prevalent mental health disorders. Dr. Swapna Varma, co-chair of the Implementation Committee, sheds light on why depression and anxiety were prioritized. These are among the most common mental health disorders, and a majority of cases can be effectively managed within the community setting. Starting in 2026, as part of the Healthier SG Preventive Care Initiative, general practitioners, GPs, will take on the role of managing mild to moderate anxiety and depression. This shift means that individuals with moderate mental health concerns can be directed by social service agencies to local GPs rather than immediately being referred to specialist institutions like IMH. Conversely, GPs can also refer patients needing psychosocial interventions to nearby social services, fostering a support network within the community. This interconnected referral system raises an important question. Are community-based pathways sufficient for treating mental health issues, or might some cases be prematurely routed away from specialized care? Dr. Varma acknowledges that while the practice guide lays the groundwork, the expansion to include guidelines for other conditions is forthcoming, though the timeline remains unspecified. A key innovation within the guide is the introduction of a shared risk score that categorizes patients by the severity of their symptoms and suicide risk. This standardization allows healthcare providers to confidently communicate about patient needs, ensuring that when one professional describes a case as involving severe suicidality, everyone understands the gravity. This clarity simplifies referrals between GPs, hospitals, and social services, aiming for smoother transitions and better coordinated care. Beyond electronic resources, Dr. Koh also mentioned plans for a handy pocket guide that will help people quickly identify available mental health support options, an effort to demystify the pathways to care and empower the public to seek help more easily. Daniel Fung, chief executive of IMH, hailed the expansion of acute psychiatric services as a positive move that will improve immediate crisis intervention accessibility. However, he reminded the audience that prevention still lies at the heart of mental health efforts. Recognizing the limited number of mental health professionals, he highlighted the growing role of digital tools as valuable complements to traditional therapy. For example, a patient might meet a psychiatrist monthly but use a smartphone app offering cognitive behavioral therapy during the weeks in between to help manage mood symptoms, blending human expertise with technological support. The timing of this announcement aligns with the 8th edition of the Singapore Mental Health Conference, held on July 16 and 17. This event features a heavy spotlight on digital mental health solutions and artificial intelligence, signaling the sector's future direction. Jointly organized by IMH, the National Council of Social Service (AIC), and the Health Promotion Board, the conference drew over 1,000 participants on the first day alone. To add to the national momentum, the government recently launched Mindline 1771, Singapore's first unified mental health hotline and textline, integrating multiple communication channels such as voice calls, WhatsApp messaging, and web chat. Operated by IMH, Mindline 1771 represents a modern step toward making mental health support more accessible and responsive to individual preferences. Ultimately, these efforts raise provocative questions for us all. Can expanding hospital-based acute psychiatry and standardizing referral systems truly transform mental health care in Singapore? How far should reliance on digital tools go, given concerns about replacing human connection with technology? And what role should community care play versus specialized institutions? We invite you to share your thoughts and experiences in the comments below. Is this new approach the breakthrough mental health care desperately needs, or are there potential pitfalls we should watch out for? 2. Singapore expands acute psychiatric services and launches mental health care guide. #### A bold new era for mental health support in Singapore. In a significant move towards enhancing mental health care, Singapore is making strides to expand its psychiatric services and improve the overall quality of mental health support. At the recent Singapore Mental Health Conference, Senior Minister of State Dr Koh Poh Koon unveiled a series of initiatives designed to make mental health services more accessible and effective for all citizens. Mental health issues have emerged as a pressing national concern, prompting Singapore to intensify its efforts to provide better access to care for those in need. During his address at the 8th Singapore Mental Health Conference, Dr. Koh shared the latest updates on the nation's mental health strategy, emphasizing the importance of timely assistance, stigma-free environments, and sustainable service models. According to the National Population Health Survey 2023, a concerning 15% of Singaporeans reported experiencing poor mental health, with young adults aged 18 to 29 being the most affected demographic. Mental health disorders now rank among the top 4 contributors to the disease burden in the country. This alarming trend has been influenced by various factors, including economic instability, the pervasive use of social media, the relentless pace of modern life, and the ongoing repercussions of the COVID-19 pandemic. #### Creating a more integrated mental health system. Singapore envisions a mental health system that is not only accessible and high quality but also free from stigma. Dr. Koh highlighted the necessity of viewing mental health as a dynamic and complex issue that impacts families, colleagues, and caregivers alike. To realize this vision, a dual approach is essential, addressing systemic challenges while also providing personalized interventions. Strengthening community-based care is crucial, as is fostering a resilient and supportive society. This comprehensive strategy is guided by the National Mental Health and Wellbeing Strategy, which was launched in 2023. ### Enhancing governance and continuity. Following the establishment of the National Mental Health Office a year ago, Singapore has transitioned from a temporary interagency task force to a permanent governance framework. The newly formed Steering Committee for Mental Health and Wellbeing will spearhead these initiatives, supported by an advisory panel that includes experts, service providers, youth representatives, and individuals with lived experiences of mental health challenges. Dr. Koh expressed gratitude to his colleague, Dr. Janil Puthucheary, and acknowledged the contributions of various stakeholders who have helped lay the groundwork for this new governance model. He noted that this transition marks a pivotal advancement in creating a more coordinated and comprehensive mental health ecosystem, while also recognizing that there is still much work to be done. Introduction of the National Mindline 1771 hotline. To facilitate easier access to help, Dr. Koh announced the launch of the National Mindline 1771, Singapore's first ever mental health hotline and text line. Understanding that navigating mental health services can be daunting for first-time seekers, this hotline serves as a central point of contact, connecting individuals to the appropriate support. Accessible via voice calls, WhatsApp, and web chat, the hotline offers multiple avenues for individuals to seek assistance in a manner that feels comfortable to them. The service also ensures anonymity, which can significantly lower the barriers to reaching out for help. Dr. Koh referred to this initiative as a first stop for mental health, reflecting Singapore's commitment to providing timely and seamless care. Ultimately, anyone in need of help should be able to find the support they require through whatever medium they prefer, he stated. Key announcements, expanding acute psychiatric services and new care guidelines. While community services play a vital role, Dr. Koh acknowledged that acute care is crucial for individuals experiencing crises or severe mental health issues. The Institute of Mental Health, IMH, will continue to function as the National Tertiary Psychiatric Hospital, but plans are underway to broaden acute psychiatric services across all public healthcare clusters, thereby enhancing access to urgent care. Another significant announcement was the introduction of the practice guide for the tiered care model for mental health, developed collaboratively by the Ministry of Health, the Ministry of Social and Family Development, and the Agency for Integrated Care. This guide outlines how mental health care should be delivered in a client-centered manner, tailored to the intensity and stability of an individual's symptoms. The goal is to ensure consistency in assessments and referrals among service providers. For example, if someone experiencing moderate distress approaches a community outreach team, CREST, they will be evaluated using a standardized tool. Should they require additional support, they can be referred to a community intervention team, COMMIT, for specialized assistance. Currently, the guide focuses on 3 primary areas: depression, anxiety, and suicidality, with plans to expand its scope to include other mental health conditions in the future. A pocket guide for the public will also be made available to help individuals understand the services offered and where to seek help. A long-term commitment to mental health. In his concluding remarks, Dr. Koh reflected on the significant progress made over the past 2 to 3 years in reshaping the mental health narrative and public perceptions. He expressed hope in seeing more individuals not only seeking help but also stepping forward to offer support and share their personal experiences. This growing openness, he noted, is instrumental in reducing the stigma surrounding mental health conditions. With a diverse group of stakeholders present at the conference, Dr. Koh encouraged everyone to engage actively, share their thoughts, and forge lasting connections. He stressed that mental health care is best approached collaboratively, rather than in isolation. Let us work together to redefine the future of mental health care and cultivate a mentally resilient Singapore, he concluded.